Hello guys, now we shall discuss the anatomy of the lungs. Okay, so our topic of discussion would be regarding the anatomy of the lungs. Now in this, what are the important things can you discuss? Now if you look at the lungs, guys, the center here we have got trachea, right? And next we have got two primary bronchi like this. We have got two bronchi, or we also called as a principal bronchus, right? And next important thing is we have got our lung like this. This is your right lung, this is your right lung, and here you have got your left lung. Okay, one is called as your right lung, another one is called as your left lung. Now here within this lung we have got some important fissures. For example, there is one fissure that is located like this. This fissure is called, which is horizontal, yes or no? So this is called as horizontal fissure. There is another fissure that is located obliquely downwards, so I call it as oblique fissure. So here also I have got one more fissure that is located obliquely downward. I call this fissure as oblique fissure. So first of all, let me write down the things which I have written over here. So this fissure over here is called as your oblique fissure. Oblique fissure. And this fissure over here which I have drawn is called as a horizontal fissure. Horizontal fissure. And here this one over here is called as again your oblique fissure. Oblique fissure. Now this is your right lung and this is your left lung. If you look at the right lung, guys, because of the horizontal fissure and because of the oblique fissure, the right lung is divided into three lobes. So this is called as lobe number 1, this is called as lobe number 2 and lobe number 3. How many lobes are there? We have got 3 lobes. Now because of the oblique fissure on the left side, we divided the lung into 2 lobes, 1 and 2. So how many lobes do we have on the right side? We have got 3 lobes. And how many lobes do we have on the left side? We have got 2 lobes. And what is this depression which you have drawn here on the medial side? This is called as cardiac cleft. This is called as cardiac cleft or cardiac notch. Okay, this is a place where the heart is forming an impression on the lung, right? So this is your cardiac notch. And by the way, this part of the lung over here is called as the apex of the lung, and this part of the lung over here is called as the base of the lung. So these are some of the important things which you have to know. So if I am telling you that the right lung is having 3 lobes, then each lobe has to be supplied by the air. Yes or no? If left lung having 2 lobes, then these 2 lobes also have to be supplied by the air. So how are they supplied? We shall look into that. For example, first of all, let us draw the lung. This is the lung, right lung, and this is the left lung. Okay, so right lung is having superior lobe, middle lobe, I told you. Left lung is having only 2 lobes. Now in the center you have got the bronchus, right? This is the trachea, and this trachea is dividing now. See, this is the trachea. It is dividing into one bronchus on the top, one bronchus in the middle, and one bronchus in the lower part. And next here also it is dividing into one bronchus on the top and one bronchus in the lower part like this. Okay, in the lower part like this. So the right side, how many lobes do we have, guys? These 3 lobes are called as, one is called as a superior lobe, one is called as a middle lobe, one is called as the inferior lobe. On the left side we have got the superior lobe, we have got the inferior lobe. Okay, and what is the name of this bronchus over here? Right, see, especially this bronchus which I am highlighting. See, this bronchus is called as right superior lobar bronchus, and this bronchus over here is called as right middle lobar bronchus, and this bronchus over here is called as right inferior lobar bronchus. Okay, in the same way on the other side, this is called as left superior lobar bronchus, and finally this is called as left inferior lobar bronchus. So how many different types of bronchus we have got? We have got 5 different types of bronchi. So what are they? Let us write it down now. So this one over here is called as right superior lobar bronchus. Okay, this one over here is called as right middle lobar bronchus. Simple terms to tell: right middle lobe bronchus, right superior lobe bronchus, right inferior lobe bronchus. Okay, So this is your right inferior lobar bronchus. Lobar bronchus. So the same thing on the left side also, left superior and left inferior. Now, after telling this important thing, the next important thing I want to discuss is bronchopulmonary segments. In each lung, we have got something called as bronchopulmonary segments. So, how many bronchopulmonary segments are located in each lung? In each lung, we have got 10 bronchopulmonary segments. So, here we have got 10 BP segments, BP in the sense bronchopulmonary. Right, here we have got 10 bronchopulmonary segments. In the same way, here also we have got 10 bronchopulmonary segments. Okay. Now, if I ask you further that in each lobe, right side is having 3 lobes. In each lobe, how many bronchopulmonary segments are located? And left side in each lobe, how many bronchopulmonary segments are located? This is very easy. So, if you look here, on the left side, we have got 5 on the top, 5 on the bottom. So, 5, 5, 10. So here we have got 5 on the bottom. So what will be the next distribution? This will be 3, this will be 2. So 3, 2, 5, 5, 5. So 3 to 5 is 10, 5 and 5 is also 10. So in the superior lobe we have got 3 bronchopulmonary segments, middle lobe 2 and inferior lobe we have got 5 bronchopulmonary segments. Now what we shall do is that we shall name what are these bronchopulmonary segments. Okay. Right. So if this is your lung on the left and this is your lung on the right. So now look at these bronchopulmonary segments. So as I have already told you, here we have got, So what are these? The apex, I already told you this part is called as the apex. So apex, that bronchopulmonary segment which is located in the apex is always called as apical segment. So here also we should write it as apical bronchopulmonary segment. After that, we have got posterior, opposite of posterior will be anterior. We have got anterior bronchopulmonary segment. Next, after that, next we have got 2 important things. Lateral, opposite of lateral will be medial. Medial. Okay. And next important thing is this entire part which you can see here, this part is called as the base. So whatever bronchopulmonary segment I am writing here, all of you should add a base, a name called as base after that bronchopulmonary segment. For example, here superior basal. Superior basal. Just remember a mnemonic, this one, SMALP, small p. S stands for superior basal. What does M stands for? M stands for medial basal. Medial basal. Next, A stands for anterior basal. L stands for lateral basal and P stands for posterior basal. So how many basals we have got? Superior, medial, anterior, lateral and posterior. How many here? 5. So here how many are there? 3. Here we have got 2. Here we have got 5. Now what I am telling you is all those 5 which you have written down, copy and paste this 5 here, which means SMALP. Left superior basal, left medial basal, left anterior basal, left lateral basal and left posterior basal. Now what are the things we have got on the top? On the top, obviously I told you the first is always which is located on the apex should be called as apical. So this is also apical. After apical, next one we have got on the right side is posterior. So here also on the left will be posterior. After posterior we have got anterior. Here also we have got anterior. But only 2 things that are different. One here is called as superior lingular and inferior lingular. So here we have got superior lingular and inferior lingular. So these are the 5 bronchopulmonary and these are the 5 bronchopulmonary segments which we have got. Okay, so why these bronchopulmonary segments are important is that whenever we wanted to remove the part of the lung, we mainly resect the bronchopulmonary segments. Okay, so if you look at a bronchopulmonary segment, how does this bronchopulmonary segment look? Each bronchopulmonary segment looks like a pyramid only. Okay, how does each bronchopulmonary segment look? Each bronchopulmonary segment looks like a pyramid. Second important thing is that these bronchopulmonary segments are having arteries, but they are not having any veins. Veins are absent in these bronchopulmonary segments. So if you look at the picture down, you will understand. What is the picture I told you? Each bronchopulmonary segment will look like a pyramid. So this is how they are looking. Okay. Sir, this is apex, this is base. Now tell me, how does this apex and base here look? The apex is always pointed towards the hilum, which means, where is the hilum? See, this part is called as the hilum. So this is the part where the apex is always pointed towards the hilum. Okay, so in this, what are the important things? First of all, you have got an artery like this. What is the name of this artery? This artery is called as pulmonary artery. Next, you have got an other artery like this. What is the name of this artery? This is called as bronchial artery. Next, in the center, you have got another important thing. All of you look here. In the center here, you have got this part which I am drawing right now. This is called as segmental bronchus, or you can also call it as tertiary bronchus or segmental bronchus. So this segmental bronchus divides like this, and there are a tuft of alveoli here. Okay, so this is a typical picture of a bronchopulmonary segment. Now, do we have any vein over here? We did not draw any vein because there are no veins here. So this red one over here is called as your pulmonary artery, and this violet one over here is called as your bronchial artery, and this one which is in the center, you call it as your tertiary or segmental bronchus. So important thing to be noted is that there are no veins. There are no veins in bronchopulmonary segment. So there are no veins in the bronchopulmonary segment. This is what you need to remember. The next important thing I want to tell you is that one of the very famous thing which all of you will be confused most often is the bronchial tree. So all of you might have studied bronchial tree a lot, right? But still at the end I am going to tell you the bronchial tree here. All of you know primary bronchi dividing into secondary, secondary dividing into tertiary, tertiary dividing into terminal, segmental and all, right? So let us see what is it actually about. So if you look here, this part which I am drawing right now, this is your trachea. Trachea is divided into two bronchi over here. These two bronchi are called as primary bronchus. Okay, so let me also write it down side by side. These are called as primary bronchus. So what is the other name for primary bronchus? The first bronchus, or also called principal bronchus. Primary bronchus are also called as principal bronchus. After that, this primary bronchus divided again into two important things. Okay, this primary bronchus divided into two. After primary, what do we have? Secondary. So this is called as secondary bronchus. So what is the other name for this secondary bronchus? Lobar bronchus. So this is something that you just have to remember it, guys. Remind it again and again, revise it, only then you will understand. If you keep on framing mnemonics and going on, it will be a lot again. So secondary bronchus. After secondary, what will be the primary? Primary, then secondary. After secondary, what will happen? There will be tertiary. So it means here we have got the tertiary bronchus. So here we have got the tertiary bronchus. So this is a tertiary bronchus. Okay, what is the other name for tertiary bronchus? Segmental bronchus. Tertiary bronchus is also called as segmental bronchus. After this, the next important bronchus which you have over here is called as your terminal bronchus. Okay, what is this bronchus over here? You have got your terminal bronchus. So the bronchi are finished here. So whatever we discussed so far, the bronchi are finished here. Now once the bronchi are finished, now whatever starts is called as bronchiole. Okay, whatever starts here you should call it as bronchiole. It means this terminal bronchus is now dividing into bronchiole. What is that bronchiole? That is called as lobar bronchiole. So here it is dividing into what? It is dividing into lobar bronchiole. Okay, lobar bronchiole is finally dividing into terminal bronchiole. Lobar bronchiole is finally dividing into terminal bronchiole. So this part over here is called as your terminal bronchiole. And finally, what do we have, guys? Finally, what do we have is that this terminal bronchiole, finally it divides into the last part. This is called as a respiratory bronchiole. So what is this? This is called as a respiratory bronchiole. Okay, now this respiratory bronchiole over here, it is having this duct. You see, these two are called as respiratory bronchioles. This respiratory bronchiole is having a duct like this. Now this duct which I am drawing is called as alveolar duct, and this alveolar duct is opening like this, right? See, this alveolar duct is opening in this way. So let me first of all draw this picture. Right. Now what is this picture about? Now all you can see here, this is called as alveolar duct. What is this duct? This duct is called as alveolar duct. Alveolar duct is opening into this wide area which you can see. This is called as atrium. Okay. And after this atrium, this entire sac-like thing which you can see here, how many sacs are there? There are 3. So this entire sac-like thing which you can see here is called as alveoli. And within this alveoli, do you find these minute sacs like this red color thing? Each one is called as an alveolar sac. Each one is called as an alveolar sac. Alveolar sac. Now all the way from here, from the respiratory bronchiole till here, this part you call it as the respiratory part. And above this respiratory part, whatever part you have got here, this entire part from the respiratory part here, right? So this entire part you called it as a terminal or a conducting portion. So there are 2 portions within this bronchial tree. One is called as a conducting, which is on the top. It is only responsible for the conduction of air. And what is the use of this respiratory part? Respiratory part is responsible for the exchange of gases. Okay, so this is the place where the oxygen, whatever is there, that is delivered into the tissues. It means the blood vessels. And whatever carbon dioxide is there, that carbon dioxide is exhaled out. So this exchange of gases is happening in the respiratory part. So this part over here is called as your respiratory part. Respiratory part. And this part over here you called it as your conducting part. Conducting part as well as your respiratory part. Right. Now what we shall discuss is that we shall discuss regarding the root of the lung, guys. Okay. So we shall discuss about the root of lung. So what is this root of the lung? First of all, let me draw a picture and then I'll tell you what is the root of the lung. I hope all of you know what is the root of the lung, but my main intention is to just show you what is the root of the lung and tell you what is located there. Okay. Right. So for example, if you look at the lung over here, right. So this entire surface, whatever you can see here, right, this entire surface, whatever you can see here, leaving this area, this yellow color shaded area, whatever you can see right now, this is called as the medial side of the lung. So how is this picture? See, if these are the lungs, these are the lungs. So this is the picture, this is the view which you are looking from the anterior side. What I'm doing now, what I'm doing is I'm slowly rotating the lung towards your side. Okay, when I'm slowly rotating the lung, you can able to see this part. If you are able to see this part, this is how the picture looks over here. Now look here. Right. So this is how the picture looks. So this is a picture of the medial side of the lung. Okay. Now in this picture of medial side of the lung, which means this yellow color shaded area, whatever I've just shown you over here. So this is the medial side. Now within this medial side, there is one very important structure which you have to understand. What is this important structure? Here on the medial side, you have got this particular structure which I am drawing here. This is called as a root of the lung. Within this root, you have got bronchi, you have got arteries, you have got veins. What are these? We shall discuss now. But I want you to know that where is the root of the lung located? The root of the lung is towards the medial side, towards the side which is facing the mediastinum. Okay. Okay, so this is called as the medial surface. This is called as a medial surface, or I can also call it as a mediastinal surface. Mediastinal surface, or I can also call it as a root of the lung. I can also call it as a root of the lung. So this is how the arrangement is, right? Now if you look at the root of the right lung, root of the left lung, how does it look? Now before me telling you that thing, you have to understand what is anterior, what is posterior. See, now I am slowly rotating. Okay, let me put the lungs like this. Okay, so this is your left lung, this is your right lung. Okay, these are the lungs which are looking from the center. Now in between both of my hands, here you have got the trachea dividing into two bronchi. Okay, and these are the lungs. Now, whatever you can see here, this is called as the anterior surface. Whatever the finger is located towards me, this is the posterior surface. Now what I am doing is that I am slowly rotating these lungs towards you. When I am rotating this lung towards you, now look here very carefully, this will be as an anterior surface only. Now till here, this will be as a posterior surface. This is the superior surface, this is the inferior surface, right? Again, whatever fingers you can see here, this is the anterior surface of the lung. This thumb which is located towards me is the posterior surface, okay? I am slowly rotating it. Even if I am rotating it, this will be the anterior, this will be the posterior, this will be the superior, this will be the inferior surface. Okay, now all of you just look at the same picture which I am drawing right now, and again I will add this anterior posterior here. So the root of the right lung, if you look at the root of the right lung, this is how it looks. This is the root of the right lung. Okay, and remember one thing, the root of the right lung down, it hangs down like this. This is called as your pulmonary ligament. So this picture which I am drawing right now is the root of your left lung. Root of your what? Root of your left lung like this. So one is the root of your right lung, another one is the root of your left lung. Now exactly here, this is your right lung, this is the left lung root. Now that anterior posterior rule I am applying here. See, the top surface is always superior, the bottom surface is always inferior. Okay, and this surface is anterior and this surface is your posterior surface. Again the same thing, this is superior, this is inferior. Okay, if this surface is posterior surface, then this surface here also will be posterior surface. It means this is posterior. If this surface over here is your anterior surface, then this surface over here also will be an anterior surface, right? So you understood which is a superior, inferior, posterior as well as anterior surface, right? Now what we shall do is that we shall draw all the important things which are located within this right and left lung. Okay, not lung, the root of the lung. Right, so here you find a small artery. On the left side you find two small arteries over here. Now these arteries which I am drawing here, these are called as bronchial arteries. What are these arteries? These are called bronchial arteries. I shall name these arteries later on, but just now just remember that these are bronchial arteries. Now after bronchial arteries, on the left side, here you have got, this is called as principal bronch. Now after this bronchial artery, here you come across another artery over here. The same position here also you come across another artery over here. What is this artery? One is called as a right pulmonary artery, another one is called as a left pulmonary artery. Now above the right pulmonary artery, the bronchus which you have is called as eparterial bronchus. What is ep? Ep in the sense epi-arterial. Above the artery there is a bronchus that is called as eparterial bronchus. Then anything below the artery should be called as hypoarterial bronchus or hyparterial bronchus. So obviously here you have got a bronchus which is below the pulmonary artery, that is why you call it as hyparterial bronchus. Now here there is only one bronchus here. There is no eparterial, there is no hyparterial. Next, the last important one is a vein. So on the left side we have got two pulmonary veins here. On the right side also we have got two pulmonary veins. Okay, so if I have to write down all of these things, what will be this called as? This is called as eparterial bronchus. This is called as eparterial bronchus, and this one over here is called as left pulmonary artery. Okay, this one over here is called as right pulmonary artery. Okay, and eparterial bronchus, so this will be hyparterial bronchus. Hyparterial bronchus. And what are these arteries over here? These are called as your bronchial arteries. These are called as your bronchial artery. And what are these two pulmonary veins? One is called as a superior pulmonary vein. Another one is called as your inferior pulmonary vein. Superior and inferior pulmonary vein. Right? So these are some of the important things which you need to know over here. Right? So just let us look at the things very fastly, whatever we discussed so far. We discussed that in the lungs we have got some fissures. What are these fissures? So one fissure which you can see over here is called as your horizontal fissure, oblique fissure, and here also oblique fissure. On the right side, extra fissure is that horizontal fissure. We are dividing the right lung into three parts. Okay, so this is called as a superior lobe, middle lobe, and the inferior lobe. And these bronchi are important, right? Superior lobar bronchus, middle lobar bronchus, and inferior lobar bronchus. And coming to this bronchopulmonary segments, they're very, very important, guys. So 10 in each of them, and this is a typical bronchopulmonary segment. And remember that there are no veins over here. So here, this is the conducting part, and this is the respiratory part, and this is the root of the lung, and these are the structures which are located within. So this is all you need to know regarding the root of the lung, guys. So thank you so much for watching my video. Goodbye.